Good. So thank you for having me today, and I'm really happy to be here. My name is Wallace, and I've been working with transgender people 26 years, since 1996. Yeah, that's right. So I think that always love talking about working with children and youth, I think, because I think that it's very different than working with adults, because adult, we're always using the affirmative approach, informed consent approach, therefore they're able to help them to move forward with their journey. But when it comes to children and youth, especially younger youth, the game is not the same. All of a sudden, the player is more than just you and your client. You have the parents. Sometimes the other parents, maybe 3 or 4 step parents in the picture, making one decision. They all have different opinion, different background, different misinformation, biases about transgender care. And you are the person in the room navigate those things. So I think that is one of the challenges there. But today we're going to navigate it together, and then especially with the SOC 8 that we have. So we're going to go over that together, and then let's see. Oh, here. So this one is a history of this one is so it's more. This one is, I think, Scott, you can talk about one of those. Yes. Do you want to? Okay, all right, okay. Because Scott was going to talk about that. But it's like this one is, I think, how many of you get the most recent copy now online? Yeah, it's exciting. I was on the plane when I saw that. And so I think the SOA, I think, is really good in some way because they take away different things, and we're going to go over that, especially the part that involve the children together. And I think that what we want is do away this, and we're more inclusive, and we want to do away a lot of with information and the way we look at gender diversity and look at gender variant and how we're looking in terms of working with children. So this will be the part that I'll focus today, and then later on, I think Scott will focus on the adolescent piece. Yeah. So I think that in this one, so what we want to learn is really about terminology, gender identity development, the gender identity strategies, and then I think important for us, what will be our role in terms of making diagnosis, what will be our role in terms of doing the assessment, and what will be our role providing mental health. And then as a social transition, how we are doing this. And I love talking about social transition because it's more than just he or she and using the gender-neutral bathroom, and it's all done. It's way more than that. And you will see that how much you have to be hands-on with the parents, with the school, and make this happen smoothly to help the clients to be able to transition smoothly. Because keep in mind, I love jumping ahead all the time. So because keep in mind, so working with children, I think the key here is not more than is a development. It's always the development. Keep that development in, because we're talking a kid with gender dysphoria, as well as development put into place. And then we're thinking how we can, based on the kids' current development, what kind of care plan we can develop to promote the outcome, or allow them to have similar opportunity like the cisgender peers do. Right? Think about this, because they come in this setting as a binary. Everything they know and the parents know is a lot of disadvantage and challenge and stigmatization for the kids already. And therefore, with this development and the gender dysphoria, how can we develop a goal, treatment goal, and treatment plan that helping this kid will have same opportunity, just like other kids do? I think that would be a very important one of that. And then, so gender diversity is not pathology or mental health disorder. I think that's very important to know. And gender diverse expression in children cannot always be assumed to reflect a transgender identity or gender incongruence. And I think this is very important. We always let the parents know gender is a spectrum. And then keep in mind, if the kids come to see me, or 5, 4, 3 years old, they are quite concrete with the way they think. Yes, we do have 3 years old come to my office. Quite a few of them, I know. And they pop up, and the parent just like, you can feel amazed. The first thing they say is not, "Mommy, I love you." "Mommy, I'm not a boy." "Mommy, I'm not a girl." You can imagine how dumbfounded the parent is, how lost they feel. But bless their heart, they bring to office. And for kids at that age, they're quite concrete. So in the gender binary system that we are in, if I don't feel like a boy, being at 3 years old, what are the image with my feeling being feminine would be like? The society would tell us what a girl is supposed to look like. And therefore, that will be something that I think I should shoot for with my gender variant feelings that I have. But that may mean that I can be all through transition in the future, or I just don't need anything. So this is very important for that, because the parents are so nervous and they don't know what to do when my 3-year-old kid present this kind of problem. And they may think that my son is going to be, or my child going to be have mastectomy, philosophy, all those things. That's not true. We need to let them know that all the gray areas. Our goal is helping the kid move step by step, one step at a time, getting toward the authentic self. Where that will be, I don't know. The parents don't know. The kids will know when it's time. And that is the thing that we have to tell our parents. So the guidance of the mental health professional with expertise in gender care for children can be very helpful in supporting the positive adaptation, as well as discerning of the parents relating over time. So we know conversion therapy is something that we don't do. I don't need to say more about that. So I think that this one is a summary for the next few slides here. But because the way I sit here is so small and my eyes will never be. So I use this one, okay? So it's the same thing, but I will go through the slide later. I think it's easier for me to read it. So the first one, the summary statement, the number one is very important for us professional qualification. We really need to appreciate of the gender across lifespan. So we understand that it's okay to be gender variant, it's okay to be different. Many clients, the parents, the first thing they always want, because they so want their kids not to be transgender, they will say, oh, I remember, I like boy things too. I dress up like a boy, but look at me, I'm still a woman, I'm married, have 3 kids. So therefore, my little boy will not be that way. So they always tell you, they justify. It's really important for you to let them know how that is different. Feeling like you present like a tomboy and you're happy, then someone with gender dysphoria. It's very, very different. And I think that we really encourage the professional to be trained in the child and family mental health. And I think that's very important. Keep in mind, not everyone needs to see a mental health professional. But our role sometimes be the supporter, facilitating, education, telling the parents how to plan in terms of for the kids' development. And then training in autism and neurodiversity. This one is very, very important. How many of you have been to autism training this morning? So yeah, that is very good. If you don't, it's like we will have some slide later, but definitely in my practice, we find out a lot of them is 6 to 9 times more likely for gender variant kids to be on the high functioning autism spectrum. So what that means is that like many of them, okay, I jumped ahead already, is saying that you will see them have eye contact, they have good verbal skill, and this is especially with assigned female at birth. So they just are very good at masking it. So therefore, there's like art and social skill, very black and white thinking, some sensory, and this is just Zoe. That's how Zoe is. But when they come to office, when you put the pieces together and when we do assessment for the autism, many of them, they are diagnosed on the spectrum. So now the new guideline tells us, if you see the kids, if you notice them, don't just look at the typical sign like the boys do. If they will not have any acting out behavior. They will have very strong verbal skill, they have eye contact. But their social skill, and then the way they look at really black and white thinking and all the sensory things, those are better indicator for you to say, hey, you know what? This is what research telling us. Let's look into this. And many parents, they're open to this. And then next one is we really want the professional to have continued education, just like you guys here today, and then we really want you to access information from multiple sources. And I think this is important. When I do assessment with the kid, everybody's different. But I always have at least one session with the parents alone. I really want, number one, because I really want to see where the parent is, any biases, where they are, how supportive they are, what kind of doubts that they have in terms of their kids' authentic gender identity. So that when I produce my assessment report, I know what I need to emphasize on to address the doubt. Because I want that a lot of times when the kid is really at your mercy to be able to move forward. Because especially if the parent, they don't agree and they don't see that is true, your report, your thorough assessment can address a lot of doubts that they have, to answer any question that they have, and so that you will help the kids to move forward with what they need next. So your role is very important, and your assessment, comprehensive assessment, be able to not just more, sometimes I don't even know I'm doing it for the kid or for the parents. It's really for the parents, but without the parents, the kid cannot move forward. So keep that in mind. So consider development, neurocognitive and language factors. So I think this is very important for us, is the language piece. Well, young kids, they really don't have the language to tell you how they feel. And they just show it with behavior, right? So remember, they're quite concrete. So if I'm not identified as feminine, identify female, then I will just incorporate anything feminine that I can think of as a way me communicate with outside world to prove that I'm genuinely happens to be a trans female. Maybe, maybe not, but that's how I feel and at that time, and that's how I feel that I need to go. And therefore, that you will see someone come to your office can be really ultra-feminine, who identify on the feminine side, or ultra-masculine, identify on the masculine side. But the funny thing is, how the parent, when they get older, guess what? About the ultra-femininity and the ultra-masculinity, they tame it off. And it is indeed, because like they like pain, they put on makeup all the time, but who on earth will always put on makeup every day? Think about it, right? Think about it. So eventually, when the parent really believe, they don't need to explain themselves, nobody challenge them, then they feel comfortable, they tone it down. So this is something that you need to let the parents know, because no, your child may not be regressing or regretting or detransitioning. Your kid actually is finding the authentic self. It's more comfortable in the way they don't need to be ultra-feminine, ultra-masculine in presenting themselves. So prep the parents about this so that they know what to expect. They don't freak out because of some warning sign, because the kids is no longer wearing tutu all the time to school, right? So that's something that we need to let them know in advance. So next one is consider consultation with psychotherapy with children and family when needed, and then promote resiliency, emotional well-being in different settings. I think that is very important. When you do social transitions, it's not just school. Sometimes maybe play date. Sometimes maybe sleeping over. Sometimes maybe soccer team. So send and then sometimes can be at church. So you can need to think of different setting, because social transition can be multiple times to adjust those settings. So provide age-appropriate psychoeducational and gender development issues. And I always tell the parents that, like, it's okay to tell your 3 years old about transgender issues. They always say, oh, they're too young to know. They're too young to talk about sex. I'm afraid that we talk about it, they will really become transgender, right? I wish it was that easy, but it is not. But it's okay to let them know that, how them to, like, as long as you use a language and a content that fit the kids' developmental stage, and so good to say anything. Talk about sex, talk about gender, all those things is a good lesson for the kids to learn. But use the language and the content that fit their developmental stage. That will be the key. So, and then discuss gender-affirming care option as puberty nears when appropriate. So I think if this is, you see the gender dysphoria and then more increasing around the puberty time, will be a good time to talk about how that journey may go. Respond as supportively to children, lead discussion about gender. I think that we are really good here, that we don't get ahead of our kid. I'll tell her, let's wait and see what happened. But the parents, some of the progressive ones, they said, nope, I planned it already. At what age my kid will block her? At what age, Dr. Wong, I want to be on hormone? And then the name change application is already, please sign it, and then we will be ready. And at 12, 13, we will have the coming out party. Voila, this is a girl. So I think it's good. They're so progressive, but what are they doing? They are buying into binary things now. They really like this is because the society have a really tough. If you want to be a woman, you want to be a man, there's a way like you and I, many of us here, the cisgender people. This is how you to be. Then you will be accepted. Then you will be loved. Then you will have same opportunity. Parents, they know the same thing. The last thing that some of the parents they're afraid is my kid's gender non-binary. What does that make my kid? Right? My kid is in between. Someone doesn't know, and over there, oh, I mix my coffee and milk and tea together. What does that? That's what they call my drink. I said, in Hong Kong, we call it yin yang. That means half and half, and it's half and half. But the thing is, so they know those things. So therefore, if I accept my kid, I want those things. And your job is, no. Let's pull you back a little bit. Let's get one step at a time. Don't get ahead of the kid. They will let us know. When it's not enough, trust me, they will have temper tantrum, not going to school, anxiety, different things. They will, whatever way, they will communicate with us that something needs to go forward or something need to change. So, and then response supportive. Number 13 is explore gender regardless social transition. So this one, I will talk about that later. So we'll talk more about the social transition. Number 14 is we really want the professional to support individual family decisions on social transition. And that's very important. Is for children and youth especially, when they come out, the whole family has to come out. So if I support my 4-year-old to able to wear a tutu to go to school, chances I may have to explain to the grandparents why this is the case. Chances I have to explain not just the school, maybe the soccer team why this is the case. So that is, you need to know about this in advance of time and work with the parent, give them the skill that they need, and work for educating a system and promote acceptance and support for gender identity in childhood. So those are the slides, but that basically is 15 points that I just go over together because it's so small. I know, they expect 57 years old doing this. Okay, anyway, so, and then I think that what sets us apart is the family work in terms of working with kids. And I really think that will be the most important, besides development, this is the second most important piece, is the parent caregiver have a range of reaction when they come to gender diverse transgender kids. And then two parents may have different reaction and about their same issues. And that is very true, especially when you're working with the kid, the parents are divorced, and they both have equal custody, and one is okay, and the other one not okay. Now, have fun. So I think that very important. I think when working with things like this, it's not ideal, but it's our job. We signed up for this. I think that what really important is like, make sure you spend equal time. If they not agree, spend equal time with either parents. Have them to let them know why this one support, why they don't support. So because sometimes many parents they don't want their kid to be transgender. It's not they don't love their kid. It's they love their kid so much that they know in our gender binary society that make being transgender so difficult. And therefore, they really have that wishful thinking that this is not true, and I cannot let that happen, right? So they will have a lot of different irrational thinking to deny it, undermining it, all those things. So having equal time with the parents is really important because on your report, you want to reflect what let's say the dad is the one against it, the mom is supporting. You want to have equal say, hey, dad's views on this, and mom's view on this, but the kid's view on this, and the research saying on this. And then now you funnel it together on your report. That's how you want to write your report. You don't want to say, I see the kid says trans, therefore hormone blocker. Then you will get an attorney letter in your office. So definitely that we need to pay attention. So this is what you want to do, so that you funnel it down very clearly in your assessment report, so that they will know, right? Even though if they don't agree, it doesn't matter. But the evidence, the research telling us this is how I funnel to. Therefore, you make this decision based on this. Even though it will go to court, even though it does, but your report will be stand firm, be able to tell why you make the decisions. So in family therapy education, sometimes social service provider can help the parents to work through difficult emotions. I think that's very true. It is very common for parents to have fear of their kids' safety, future success, and independence. And it is important to address the grief the parents that are going through. And I think that's very important. Because I always tell the parents, because they feel like, a lot of times they will tell you they feel like their kid is dying. Literally, this is how they feel like. And so their daughter is dying. They know that their son will have a son, but the son will not become a son in their mind until 18 years from now. So you can imagine that process in between, how the grief and the loss and the process that they have. So we need to help them to. We need to acknowledge they're going through different stages of grief and how they may impact the way they're accepting, supporting their kid. For some family, the family work can be expanded, including extended family, such as grandparents, the aunt, uncle, and cousins. And this is very, very, very true. So in this morning, we're talking about double minority, and which is very true, because if the kid may not, let's say this is a teenager kid, like just puberty coming to mom, that I am gender non-binary, I'm a girl, I'm a boy, doesn't matter. So at that time that the kid come out, the kid is really nervous, start to cry, very emotional, and the parents, why? Why do you feel this way? How come this thing? Must be the internet, must be Zoe that you spend time with. That's why you are trans, right? And the kid's feeling like smaller, therefore nothing get done. Nothing, right? They're coming out, typical one. That's why if you're including the aunt and uncle, they are the one doing the buffer effect. When the kid have no knowledge and no language to talk about this and cannot feel so powerless talking about this, it's good to have auntie call the mom, oh, I know this. This is very normal. This is what happened. And it's okay. That is so much better than coming from you. So much more credit coming from the kid, because now that is a trusted family members saying about those things. So a lot of times that your work may be really behind the scene, not so much face-to-face like with adult, right? So that's a very interesting kind of path that we go with. Rather than bang, go like this, we go sideways like this. So it is a special truth for some culture that respect gender collectivism will. So that's very true, like especially for my culture, like Chinese, like coming out, we really see that there is an individualistic view. So you become an authentic self, is an individual, is a Western thing. So that means that so a lot of time I see the Chinese family, the parents always say, why are my kids so selfish? Has the kids think about this? Right? So they don't think about the kids. It's not that they don't love their kid, but they come from a collectivism view. So for some family, it may be important to include the local faith, even like the faith support. So sometimes very important. So in my session, sometimes I will have a priest, sometimes maybe have some elders to come into. So it's not unusual to have that. So, and then you've, with one close adult relationship is 4 times better. So if you can just have one adult who can support the kid is way better. And be with the parents, social worker, foster parents, sibling, extended family, as much as you can. And then there's an infant act in British Columbia. What that means is the kid is mature enough to consent. Therefore, the kids can be consent to the treatment, even the parent may against it. But a lot of time, people always say, oh, we have infant act, we can do this. But in reality, I mean, in legally, yes, but practically, it's no. Think about it. I mean, my 5-year-old kid, yeah, you know what you need. So can they really consent to come see me without their parents? Who's going to drive them to my office? I mean, most important, who's going to pay? Right? Who's going to pay? And if they go for medication, who is going to buy the medication? Right? So you don't want the kid coming out to you, consent out, but next thing, what happened to the kid is they're homeless. Right? So that is not working. That is not the best outcome. I don't want my client to be on hormone blocker and become homeless. Right? So I advocate for transitioning while considered the risk, like I said earlier. So terminology, this one's pretty straightforward. So, and of course, when it comes to transgender kid, we have like transgender, gender diverse, all those lists. And then, and I think that some in the use of term is transgender children is now quite common in clinical and research. And because diverse gender expression children cannot be always assume that they will have a transgender identity or they can be gender incongruent, so we have to be careful when we use what language we use. In WPATH, we use gender diverse, and good and bad with this, because gender diverse is we are using in this one, but we need to understand gender diverse can really cover quite a bit of things. Gender diverse can be someone to happen to be a feminine boy, a masculine girl, right? Or can be someone that they want to dress differently, or someone that asserted that I am a boy, I am a girl, I am non-binary. So gender diverse, we need to know is covered quite well, and then we need to know that just because we use gender diverse doesn't mean this kid always end up to go through all the treatment that they may need. Some of them, many of them, they don't. So the gender development and the history is like understanding. I think this one is good. So the existing knowledge about the gender identity development in childhood, particularly in gender diversity, is very, very limited, which is very true because doing this for so long, I always feel that things just show up in my office and the research is not there yet. It's always that way. When I start 26 years ago, it's all adult, and then later on, we'd be like older adolescent, and then puberty kids, and then younger kids, and then I have like young kids, and then I have a gender non-binary. Before I think I cover all my ground, then now we have autistic kids. So research is really chasing, but then we don't have it. So it's really keep in mind that they're very limited. And there are a number of different theories how gender development is. So I think this one is good. This one, especially the Colbert one, is quite interesting. I love her work. It's like they're talking about gender identity, gender stability, gender consistency, and there's also cognitive feeling, social theory about how to explain gender. But I really agree with Josh. None of them are not really good. Not that I don't respect them, I do. But when we're looking at them, because they're really using gender binary way to look at boys and girls. The way when at the time they know they're boy, at what time when they know they're girl. What about at what time they know they're different, right? And what about the gender? What about a gender non-conforming kid? Just different gender expression. They don't really cover that. So I think the thing is good enough. So I think that is something that. So what we want to use back then we have some study. This one is good. I always use this. So this one is the study that we have. Remember, we're so lack of research. And then, so when research come out back then, they're talking about like really famous. They have kids. They have meet the gender dysphoria diagnosis, and then therefore those will be good subject for my research. They are my research subject, and therefore then I follow them for 5, 6, 10 years. I want to see how many of them still transgender and how many of them deceased. I hate that word, but deceased. And then in here, that you see the most famous one is one of that always used, maybe because he's Canadian. Dr. Sucker's one is 20%, right? Dr. Sucker's not here, right? He's a good guy, but we're just different in certain things. So I thought this one is really important because a lot of anti-trans people or parents, they will see that, hey, if only 20% chance for my kid to grow up to be transgender, 80% of them, that means will grow out of it. why do I need to social transition my kid? Because if I social transition my kid, changing birth certificate, changing gender marker, and then changing the name, using different bathroom, telling the whole world that it's not Mary, it's Johnny, and then at some point that my kid will become Johnny again. Why would I do that, right? Just like if I tell you only a 20% chance that you'll get lung cancer if you smoke, why bother to quit? Right? And that is that is what happened with the early research that we have. But what we have more recent study, and so transition, what we find is like for 3 to 12 years old, if you allow them, actually the depression, the same peers are no difference than people who are non-trans, and they may be slightly more higher anxiety, but so I think that's important. So the rate of anxiety is significantly higher, but relatively speaking, the outcome is not that much different than the cisgender kid. And then this one is the most recent one, is Dr. Olsen. I'm sure Dr. Olsen is here somewhere today, but may not be here. So this is the most recent study that she did, and then with her colleague. So what she did is this time she had 317 kids. And the way she picked her subject is different. It's not that they said they want to be a girl, they feel like a girl. It's those that they said they indeed they really see that very significant gender dysphoria that they have. And this one is only followed them for 5 years. And what we see, the interesting is 94%, they're consistent to see their gender identity as what they identify as. So which is very different than 20%, right? So gender identity development for cisgender children, and so gender identity development for diverse children, I think a lot of times, because like I said, they use using a binary way to look at kids, they would overlook the fluid, the complex, and the nuance part of it. And they also overlook the biological, cognitively, and social-emotional piece of it. And children are both gender diverse and neurodiverse may not even be included in this sample. So like I said earlier, now we know a lot more than we did in the past. So we do not know why some kids become transgender, or other become non-binary or cisgender. We're still doing more research, but gender diversity is the best understood as an interplay with biological, environmental, and cultural factors. And we do know that gender diversity is not a new phenomenon. It's as old as like in many cultures more than a couple hundred years ago, especially in some Southeast Asia before the colonization happening. Like Polynesian, we have word for the people who are Mahu, we call them Mahu. So we do have a place for them until the flip and everything gone away. But now the Western culture telling us what is it again. So we also know the attempt to change a person's gender are considered harmful and unethical. I don't need to go over this. So we can draw on gender development research to help us understand the children's gender. Most children have a stable sense of self in their own gender at the age of 4. So just like they come to see me 3 years old, 4 years old, 5 years old. And some children will begin express a discomfort as early as early age. And like I said earlier, so I think what is the gender development in terms of the underlying principle is gender diversity is an expected aspect of human development. And then we need to understand that it's not a pathology or mental health disorder. So I think this is when it's the statement that in the SOCA, they said like we need expertise in gender development and gender diversity in children, have developed expertise in general child and mental health, and we need to understand the autism, the neurodiversity piece of it too. And those are very, very important. I think the development is very important. I only have 15 minutes, but one last example. Okay. So I think sometimes that we say like, okay, if you social transition and then I'll cover the development, that will be enough. And that's not true. Your role, when you develop that social transitional plan, the kid is still developing. And different age, the kid will have different developmental tasks that they need to fulfill. And our job is we know what the developmental tasks for kids are like. Our job is to prepare the parents. When the next developmental phase come up, what we can do to foster your kid to have similar opportunity, to expose to activity, to be able just like the cisgender kids. For example, many of them because they don't feel comfortable in their body, they don't feel they're not passing well, therefore they don't want to date. So 14, 15 years old, they don't want to date. So, but what happens is you see in the high school, 14, 15, 16, they kissing, they making out under the tree, all those things, they're doing it, right? But the transgender kid, they don't feel right doing it. So what they think is that, you know what, I'm not doing anything until I fully transition. And then, voila, I can date now. But by then, I'm 21. So I'm someone, 21 years old, learning how to date with the skill who are 14 years old. No wonder they fail. And society will say, no wonder, see, you have mental health. You have borderline personality disorder. Why? Because look at you. You can't even let go of your love. You grab him like a mop. Right? So we really set them up to fail. And we don't know how the system condition us to pathologize and set the plan. And then we say, you know what? You cannot do it. I know that's mental health. We need to think really think out of the binary system and think how the binary system, the damage that we do, and the biases with our plan that we sell to the parents. Right? So take home with that one. I think that's important. So I really take a little bit of time to talk about autism. So, and I think this one is very important. It's 3 to 6 times more likely to go over this. I know I'm rushing because normally we take the whole day just talk about this. So you give me like 25 minutes. So that's all you can get. So 3 to 6 times, and then we know the masking. The masking is very important. Research is telling us that biological female, assigned female at birth, they are very good at masking this autism symptoms that they have. If you sense there's something that you feel your client may be on the spectrum, even though they function quite well, do you make that recommendation to the parents? Do you let them know why it is important? But keep that in mind, just because the kid is autistic doesn't mean the kid doesn't know their gender identity. It doesn't mean the kid is confused. What it means is the kid may have more difficulty to apply the skills, may have more difficulty to processing the abstract information. That is something. So we just need to hold their hand a little bit closer. But doesn't mean that they're confused. It's very important to let the parents know about that part of it. So, and then, so this one, DSM diagnosis in the most, is a DSM-5-TR, is similar to this one. So this one is basically the person have maybe insistent they're the opposite gender, they like to play different games, dress differently, play differently, have different toys, and they don't want to play with their playmates who are the same sex, and then they really want to reject some of the sex characteristics. So if they have like 6 or 8, therefore they will have the diagnosis. So, and then ICD-11, this one is, instead of calling it gender dysphoria, they really call it gender incongruence. So this is a term that they use. So I like to use a case example here. We're not going to go case discussion, but just really fast. So why is 7-year-old Chinese boy, an immigrant from Hong Kong, and his parent is concerned about white feminine presentation, why admit that he likes putting his sister's dress and hope that he can wear them more often. He likes watching TV shows and into those that is stereotypical for girls, like Hannah Montana, that kind of shows. At times, he will pretend to be the female characters in the show and put the towels over their heads, pretend that he has long hair. He does not like to play with boys and admit that he wants to be a girl on several occasions. So if you see in here, so definitely that white probably have 6 or maybe 8 of them. So therefore, this white will meet the diagnostic criteria for gender dysphoria in childhood. But the interesting thing is, I can guarantee you 100% white is not transgender. Why? Because this is me. Oops, you. I am white. So now, take this and take this. So they have value to it. I think the gender dysphoria for adult is more accurate to describe the distress between your born sex and your affirmed gender. But when it comes to children, they're looking for all those gender role, gender expression. Even the toys that you play is genderized. I mean, how many boys that you play dolls and when you're young? Exactly. And how many girls you climb trees, you like playing in the mud? And how many of you don't wear makeup today? Oh my God, if I go through the list, 30% of you will be transgender here. And guess what? And you'll be in my study. And see how many, 10 years from now, I see how many of you will be transgender. Think about, see? Now we kind of get what we're talking about, right? So I think that we really need to, should gender diagnosis being exist at all for young children? I think it's constant debate, right? And should it apply to children? Because we really may be unnecessarily pathologizing them. Like I said earlier, I just happen to be a sissy boy, and people may think that I'm transgender. If my mom is liberal enough, playing that, at what age change my gender marker, apply a new birth certificate, have a coming out party, give me hormone, all those things, imagine that. That's not my path, right? So, and then when children have distress, and insurance dependence diagnosis, this is really interesting. This one is like, because we function the Western medical model, you have to have that diagnosis, whether you like it or not. The kid need to have that diagnosis to see me to be able to refer to children's hospital. They need it. So therefore, whether we don't like it, we still have to use it in certain ways. So it's a very love and hate relationship that we have. And so, so I think that under our purpose, we want people to take with you is expect as per general human development and understand that gender diversity really is not a pathology. And it's okay for someone who don't like to play with makeup, who like to wear dresses to school. If I want to wear dresses to school, I will be just a guy who wears dresses to school. I will not be because I wear dresses, then I am transgender. Maybe, and it's okay. But that's something that we need to keep that in mind. So, and then question and thought is like, why do we want to predict the future? And should we predict the future? And do parents need to send a finality of their children? I really think that we don't, and we can, and I bet that a lot of times you feel the pressure. The parents want to know. The parents want a definite answer. And it's our job to let them know the gender diversity, the gender spectrum, not to get ahead of the kid, how we can move forward like one step at a time and mark along the development so that we're able to better support our kid. So, and the gender astrology is since we cannot predict the future, any of this outcome can be quiet. Someone can be, they just can be cisgender, have traditional expression, to all the way someone to maybe transition fully or non-binary. So it can be many, many outcomes, many, many gray area. And I think sometimes very difficult for the kids too, because because we're in gender binary system. So I don't feel female, I identify as male, but later on, I feel like, you know what, I'm just 80% male. The way I see it. So I would tell Mom, I'm not male, I'm demi boy. And then later on, I'm definitely on the masculine side, but I don't need to be as masculine as the way I feel. Then, Mom, I tell you, I am non-binary transmasculine. So they will come up labels like this and tell the parent, and it's okay, sit back and relax. Your kid is not confused. Your kid is not changing their mind. What they know is it's a good thing because your kid is maturing. They're learning where they are to be the authentic self. Let's celebrate this together. Let's support your kid, allow your kids to change so that they feel safe to explore and consolidate their gender identity. If you don't do that, you question that, oh my God, you tell me, see, I told you, you know, so blah, blah, blah. The kid will, I guarantee the kids will never feel safe to tell you again. Because if I tell you again, Mom will think that my identity is not real. right? So my mom thinks that I'm not real. If I want to go for hormone therapy, how likely my mom will jump on board for this? Right? They don't tell you. So it's very important for us to tell the parents those things, teach them ahead of time so that they know what's coming. When they see things like this, they will not freak out on things like that. So, and the underlying principle, I think it's really important that conversion therapy is harmful, so we learned that already. So do all gender diverse need a comprehensive assessment? Some do, some doesn't. It really depends, right? Some of them, I will tell my parents, they really have the skills, they have the knowledge. I will say, you know what, just provide the environment and help the kids to explore and learn. When the kid ready to go to school, we can come back. We can develop a safety plan or transitional plan to help your kid to transition in school. What may that look like? It's more than just bathroom, name change, and PG classes. What about when to go to school? Should I transition in the beginning of the school or in the middle of the school? Should I go back to the same school, everybody know my previous gender identity? Or should I start a brand new school, nobody know my history? All those are big decisions. All those have pros and cons. It's our job to let them know, to walk through it together so that they can make informed decisions. So when do we take a deep dive to be doing all this? I think that's especially when you see significant gender dysphoria in the kids. I think that's important. But a lot of times that with the family work, that is something that you can really do because at some point, if the kid run into different obstacles or different issues, you can always be able to provide support for the kids. How does working with children different than working with adolescents? I mentioned that already. So I think the role of the assessors really need to know that what are we assessing? Really, who is our customer? Who is our best interest? I think we really need to think about that. We need to keep the developmental piece in mind. We need to keep safety in mind. We need to work with the parents and expand the system. We need to work with multidisciplinary so that we will be able to, when we do the assessment, that will be cover different area and also cover my biases and my blind spot. So, because I'm like 3 minutes, I'm just jumping like crazy. I think that we understand that for a mental health professional, we really need to provide consultation. A lot of time we can facilitate changes. It's not unusual that you will go to the school with the parents together and educate the school what to do. A lot of times, BC is getting better. Some schools, they say, we don't know what to do. They say, that doesn't fly. I will teach you how to do, right? It's that we don't have resources. We will find you people, educate your kids what to do. Educate them, because it's not the kid's role to go to school to be the poster child of transgenderism. It's not the kid's role go to school and explain why I'm transgender. Why should I tell you that why I feel this way? No, it's not the kid's role. It's not fair for the kids. The kids just want to go to school, blend in, and have fun and to learn. And that's what our transitional plan help them to do that. Whatever else, we need to develop a plan when things like this happen, who else to deal with it? How do they deal with it? So that is the plan I'm talking about. So it's not unusual. You will be taking an active part of the role and accommodate parents. You cannot do this. This doesn't fly. This is not good for the development. And let them know why. So that's very, very important for us to do that. So in terms of assessment, really, I like that using the biopsychosocial and spiritual and cultural factors. So cultural factors, I think a lot of times that we, especially with the kid, the family piece is very, very important. So social transition, I think this is the part that I'm talking about, is that it's more than just helping the kid to changing the pronoun, changing the name, using different bathroom. It's really different, a lot of things to do. So a lot of time that the research telling us that many of them social transition is actually the kid, they have much better mental health. When they have someone support in the school, they're less likely to miss school. They have less anxiety. They do a lot better at school. And those are the statistics that share with the parents, share with the school, why it is important to support your client to be able to be who they are. Because a lot of times they say, we don't use they in school because other kids will be confused. They need to learn, right? They just need to learn. I'm sure they're confused when they're calling my Chinese name, but I'm sorry, you just have to call my Chinese name. So I mean, like it's Wai Chong Wong. You cannot pronounce it, learn it. And just like you have to learn using they, right? So we said what we see here is that trend of puberty children and social transition actually is more and more doing it. And then the good thing is their mental health and their social emotional adjustment outcome is a lot better than those who are disallowed to do those things. So I think a lot of times that we will talk to people, oh, our time is up. So the benefit and the challenges, I think definitely I talk about this, but definitely in the future, email me, more than happy to talk more about this. But thank you so much.